I am going to give a subcutaneous injection to my patient, but first I will make sure that the scene is safe, free from any spillages, cords, cables, and clutters that may pose risk to me, to my patient, and others. Once the scene is safe, I will do my hand washing according to WHO standards, adhering to the 5 moments of hand hygiene, before and after touching the patient, before any aseptic procedure, after touching body fluid risk exposure, and after touching the patient's surroundings. I will place a handful of product all over my hand. I will do this for 20 to 30 seconds. Rub palm to palm, back of my hands with fingers interlace, palm to palm with fingers interlace, back of my fingers interlock, rotational rubbing of the tips of my fingers, rotational rubbing of my thumb, and rotational rubbing of my wrist. Once my hands are dry, it is now safe to approach my patient. Hi, my name is Belle. I will be your nurse for today. How do you prefer to be called? Oh, that's a lovely name, Andrea. Can you see and hear me clearly? Alright, that's good. Are you warm enough? Alright, is that alright if I close the doors and windows to provide you some privacy and preserve your dignity? Closing the doors and windows. Quick hand rub. Andrea, can you just confirm to me your full name and your date of birth, please? Alright, it's the same with your notes. And also, have you got any allergies at all? Alright, it's also written in your notes. So Andrea, I am here today to give you a regular dose of insulin, which is glargine. This is for your diabetes mellitus. Common side effect later on might be some dizziness and also soreness in the injection site as it involves needles. But don't worry, I will be monitoring you for the next 60 minutes. So if you need anything, just let me know. Alright? And also, can you remember where was the last time you had it? Is it in your upper arm or in your tummy, around the umbilicus, on your hips, or on your buttocks? It's really important to have the changing of sites every time to prevent lymphedema and also for better absorption. Alright, so you had it on your tummy last time. Would you have any preferred site now? Alright then, we can have it on your upper arm then. Is this the right time for me to do it? Are you happy for me to do it? Alright, that's good. So, can you just give me a minute? I'm just gonna prepare the materials in the other room. If you need anything, just give me a shout. Alright, thank you. I have here my tray, clean and disinfected for the last 24 hours, safe for me to use. Hand rub, clean, dry, and intact, expires 2024. A box of gloves, clean, dry, and intact, expires 2025. Sharp spin, dry and intact, it's not past the warning line, and I can open it 3/4 and close it 3/4 after use. Two alcohol swab, clean, dry, and intact, and expires 2024. My injecting needle, clean, dry, and intact, expires 2026. Cotton balls, I will make sure that it's clean, dry, and intact, and from a container which has not passed expiry date. And my medication, insulin glargine, 100 units per ml, counter checking it with my prescription. And it's not past expiry date of 2025, and it's not open past 28 days. Before giving any medication, I will adhere to the rights of drug administration that I got the right patient, right drug, right dose, right date and time, right route and method, right diluent if applicable, recheck for allergies, and also that I will make sure that the prescription is valid, legible, signed with the prescriber with blip number. If any of this is missing, I will not give the medication and consult the prescriber. And also, if I'm unsure of the medication, I will check the British National Formulary. Now, I'm gonna prepare my medication. I'm gonna wear my apron, making sure that the clean part is facing my patient and it's not touching the floor. Hand rub. Don my gloves. I will clean the vial, giving it a good clean and letting it dry for 30 seconds. I'm going to open my syringe. Check for functionality. I'm going to withdraw my medication on the eye level and bevel up. I'm going to withdraw 14 units of glargine according to the prescription. Recap using scooping method. Remove the bubbles by pulling the plunger down and up and gently tapping it. Assessor, this is insulin glargine, 14 units. I'm gonna remove my gloves and throw it in the clinical waste bin. Quick hand rub. I am now going back to the patient, making sure to close the doors and windows. Hi, Andrea, I am back with your medication. Are you comfortable? Alright. Before we proceed, is that alright if I do a second identity check? Can you just confirm to me your name and your date of birth, please? Yes, it is. Andrea Jones, 5/8/1990. That's the same with my notes. I can confirm that I got the right patient. Can I roll up your sleeves? So I will inject it on your right upper outer arm. And then I'm checking now if there's any signs of inflammation, edema, infection, and skin lesion. I can see there's none. So it's safe for me to inject on that side. Are you comfortable? Alright, that's good. I'm going to don my gloves. I'm going to clean the injection site, cleaning it from inner to outer for 30 seconds. Cold wipes coming, 1, 2, 3, 4, 5, and allowing it to dry for the next 30 seconds. 1, 2, 3, 4, 5. I'm going to get the cotton balls, place it in between my fingers in my non-dominant hand. Okay, Andrea, I'm going to pinch your skin. I'm giving the injection in a dart-like manner for 90 degrees because I'm giving an insulin using an insulin syringe. Sharp scratch coming. Injecting it. Releasing the pinch. And administering the medication for 10 to 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Rapidly withdrawing it. Putting the cotton balls, applying a gentle pressure but not massaging the area. Activate the safety lock. Alright. Are you comfortable, Andrea? There's no bleeding. Okay. Can I roll down your sleeves? So, Andrea, I've given you your insulin via subcutaneous injection. So, if you need anything, just let me know. I'll be just in the other room to do my documentation and aftercare. If you need anything, just give me a shout. Alright? Thank you. Now, I'm going to do my documentation, removing my gloves. Unwrap. My name, my signature, the date and time. Unwrap. For my aftercare, everything that touches the patient, including my gloves and apron, will go to the clinical waste bin. And other wrappers and rubbishes will go to the domestic waste bin. And the sharps will go to the sharps bin. And the tray and other materials will be cleaned and disinfected for the next use and be placed back in the right places. And I will make sure that the storage of the medication will be according to the manufacturer's policy.